That's a lot of
Hey,
pull-ups.
Mayor Suarez, how you doing?
That's a lot of pull-ups.
Yeah, I mean, that's part of the routine, 200 every day.
Wow.
Absolutely.
No
How you
joke.
doing?
Doing well. Doing well.
Yeah,
All
thanks
things,
for
all
thanks
things
for joining
considered.
us.
All things
Huh?
considered. All things considered.
Yeah, exactly. And obviously, it's a very busy time for you, and
Sure.
we're very thankful for your time.
Got it.
I just want to do a little background. Obviously, Mayor Suarez is the 43rd mayor of Miami. He was elected in 2017. His background is law. He's actually the first Miami-born mayor, which is kind of interesting, I thought, but something to note. And it's always good to have the mayor just based on his position and his leadership. But I think it's even more important considering what we're going through. I think many people would consider Miami to be the world epicenter at this point in time with COVID. And so with Mayor Suarez at the helm, it's great to get some answers and see where we go from here. So, thank you again for joining us. Obviously, very grateful for your time.
Thank you, Doctor. It's an honor and a privilege. I know you guys are on the front line of this COVID-19 battle, and you're also at the highest risk of getting infected. What people don't understand, maybe are not looking at the statistics every day like I am, is that healthcare workers are the #1 category of employees that are getting sick. And and it's like almost a quarter of all new infections. So that's something that, we're looking at, and the public should know that you guys are not only, doing everything you can to keep us from getting sick and sicker, but you're also exposing yourself and risking your own health. And so that's something that we're very grateful for.
Well, along those lines, you were one of the first people in Miami-Dade to get COVID. Can you tell us a little bit about what it was like to get COVID? How severe was it? Was that when you realized that this was a serious problem?
It was a very weird experience for me. As you said, there was only one other person that had gotten COVID in the entire Dade County of 3 million people now. We have, tens of thousands of people that have gotten COVID since then, unfortunately. And it was very eye-opening and very, very strange. I had only been in a room with someone who had said that they were positive. That's what happened essentially. And basically I was asked to quarantine, and I was recommended that I quarantine right away, which basically saved, I think, my wife and my 2 children from getting sick. And I got tested right away. And I found out the next day that I was positive, which was a huge shock to me.
How close were you to that person in that room? I mean, was it within 6 feet? Were you sitting next to them, or was it across the room?
We were definitely within 6 feet. We probably shook hands more than once. We may have had a conversation. I can tell you that I wasn't even sure, because there was a delegation from Brazil. And I was told later on that there were more than 50 people from that delegation ended up testing positive. I can confirm that. But I wasn't even sure that I had actually been in contact or in close contact with the person until I got a call from a friend of mine who told me that I was in a picture. We were in the same picture, within a few feet from each other. So I sort of jogged my memory, and I thought I probably shook the person's hand and most likely had a close conversation. And that's all it took for me to get infected.
Yeah, just goes to show you how incredibly infectious this virus is.
Absolutely.
When did you first realize that this was going to be a serious issue for the city of Miami? Like, when did it really hit your radar?
We were actually very lucky. We were very proactive, and our fire chief really started tracking this right around the time of the Super Bowl. So we were actually one of the first cities in late January, early February to start tracking this. He ended up doing a big bulk PPE purchase, which was over $1 million. And at the time that he bought it, obviously there were supplies. By the time we ended up getting hit in mid-March, the supplies were going fast. So he was very smart. We were the first city to cancel large events. If you remember, we canceled Ultra and we canceled Calle Ocho. And I was criticized for that. Some people said, that I was sending the wrong message, that Miami's open for business. I had other elected officials, say that they weren't going to cancel events, and they ended up canceling events like the Miami Open and I think the Youth Fair. So that was in early March. So we really saw this coming, unfortunately. But I think this has been, and I've been on calls every day. Every day I'm on multiple calls. And I can tell you that, this is something that I don't think the nation was prepared for, frankly.
Yeah.
And this is something that the scale of it, and in some ways, and I have to say, in some ways, we're lucky because if this had been a more lethal, and this is a very lethal virus, but if it had been more lethal, right, had it had a mortality rate of 50% or 75%, I mean, this would have been a major problem. And what it has exposed is how woefully underprepared we are as a country for this. And I really think, hopefully, when we come out of this, we really have to do a very, very strong post-mortem and figure out how, just like we do with hurricanes. We have a hurricane. That's why I'm dressed in my my firefighter stuff. We have a hurricane on the horizon now, but we have to really do a deep dive self-analysis. We're woefully behind on contact tracing. Our contact tracing is abysmal right now. We have not gotten, and I'm not trying to complain, but we have not gotten that kind of guidance from organizations like the CDC, the health department, that would allow us to make better decisions. We've had to cobble together our own experts, our own sort of group of experts. So I speak to health department 3 times a week. I brought biostatisticians, epidemiologists, all on calls. And of course, we have hospital administrators all on calls to try to make the best decisions. But frankly, it should be a top-down approach because there are organizations like the CDC whose sole mission is to control diseases. The health department's sole mission is to keep us healthy, and they have many more resources and experts to be able to guide us. And unfortunately, one of the worst things that has happened is that this came in a political election year, and I think this has become way too politicized. A healthcare crisis should never be politicized.
For sure. I mean, and along those lines, how much guidance, how much support have you gotten from the state? So DeSantis and the entire state, are you getting a lot of support either statewide or nationally?
So I'll tell you sort of the good and the bad, right? So to be fair, the governor has always taken my calls. There's never been a time that I've tried to reach out to the governor that he has not taken my call. He has always been very forthcoming in terms of the information he has. And he has tried to get me the resources that I need. For example, one of the things I asked for was more isolation rooms for people to be able to be isolated. He gave us, his emergency manager, Jared Moskowitz, immediately rented a hotel room of 400 beds. We worked with the county to create a model where we can isolate people who may not be able to isolate. We did that within a 3-day period. We've asked him for 500 additional contact tracers. He's dedicating more resources, but we're way behind. I mean, we're at 350 right now, and we really need to be north of 800. So we're getting very, very far behind. Right now, we successfully contact trace at a rate of about 30%, which means 70% of people are not being contact traced. Our period of time waiting for results is way too long, and so that goes to the White House. They're now sending 2 surge labs to help reduce the amount of time, the wait time that people are taking, because contact tracing is effective when people are sick. Yeah. You can get them isolated, or you can get them and you can trace their contacts. But we have right now, 2 search teams that are supposedly coming in from the White House. In the last 2 weeks, we've had the Surgeon General come down, one of the heads of the CDC, if not the head of the CDC, Admiral Ian Marcos, and I just spoke yesterday to one of the members of the task force. So I think the White House is getting the message that we need their help.
So, along those lines, talk to me about the shutdown. Talk to me about, as mayor of such a large, vibrant city like Miami, how difficult is it to shut a city down like that? And talk about the balance between physical health, kind of constraining the virus, and then economic health. Obviously, the city loses a huge amount of money, and that crushes people as well. Talk about those factors that you have to consider as a mayor.
It's incredibly difficult. One of the things that you can see is that they're inversely correlated. So we have what my good friend Dan Gelber, the mayor of Miami Beach, would like to call a crowd-based economy. Our economy is based on people getting together. It's based on people going to bars. It's based on people going to big events. And so it's incredibly difficult to deal with. And we're an affectionate city. We have big families. We like to get together. And so there's an inverse correlation between our economy doing as well as it was doing, and it was doing phenomenally well prior to COVID-19. We had, you know, historic unemployment. We grew my first year as mayor 8.5%, and 10.5% my second year. So a situation where we had a $20 million surplus prior to COVID, and now we have a $25 million deficit after COVID. So the economic devastation that this has wrought has been incredible, unprecedented. The amount of unemployment, the amount of people who are employed who are making a fraction of what they were making before. And you have to balance out the fact that when we shut down the first time, our peak number of cases was 533, and we had full employment. We had a huge federal safety net with unemployment benefits that were going to increase unemployment benefits from $250 a week to $850 a week, which is a significant increase. We had the PPP program, which gave hundreds of billions of dollars to small businesses for their payroll to keep them open. So, I mean, we had a significant amount of federal resources that we don't have right now. And that is another concern with potentially having to shut down.
Yeah, I mean, do you think, well, two questions. One, do you feel like we may have reopened too early, potentially? Looking back, obviously hindsight's 2020. And the second part of that question is, are we looking at another shutdown?
So, you know, it's a great question because I get it a lot of, did we open too early? And my answer to that is sort of backwards than what most people would think. It's, did we close too early? And I'll tell you why I say that. New York, it's a huge state. It has right now about 600 cases a day, which is significantly less than the state of Florida, right? If we have a good day, we're at 8,000, right? If we have a good day in Miami-Dade County, we're at 2,500 or 2,000. And what happens is they saw an incredible amount of devastation. Their mortality rate was almost 8%. There were people dying in the hallways. There were, trucks that were coming on, body bags were being brought out. And so I think the fear of this virus set in Miami because of what was going on in New York. We closed very, very quickly. And so that fear never really fully set in. So when we opened, I mean, we had days where we had 100 cases. You know what I mean? A day, right around the time that we opened. We had met all the gating criteria and then some, right? The gating criteria called for 2 weeks of continual decline. We had a month of decline. We called for, sufficient, our percent positive rate was very low. I think it was 5%, maybe less. Right now, our percent positive rate is at 18%. So it wasn't that we opened, I think, too early. I think the problem is that when we opened, somebody was saying this the other day, that it was like the last day of school, where everybody's just like, boom, we got to get out. It's 2 months of being confined. And then it was just like party time, and I think people lost respect for the efficiency of this virus in spreading. And just so we were talking about, in my case, this virus is just incredibly efficient at spreading. And, and we have to respect that. That's one thing. That's why we've asked for a mask in public rule and so many other rules.
Now, how do you take into account the real problem, which I think most people would say is just human behavior, right? So you tell people, to kind of socially distance, wear masks, wash your hands, and it turns out no one does it. What can you do as a mayor to enforce and to combat what is normal human behavior, which is just socializing, being close, wearing a mask might be uncomfortable? What do you say to those people?
Well, first of all, I agree with you that it's something that's a challenge. You think, I can't tell you the number of times. I mean, I got in a lot of hot water because I took a picture at a restaurant where I was at, and the person who took a picture of me, I didn't have my mask on at that particular moment. I wasn't supposed to be wearing a mask in my seat, but when I stood up, I should have gotten a mask or told the person, hey, you gotta. So it's very easy to make a mistake like that. The margins are very small. And in my case, people are constantly coming to try to give me a hug or shake my hand. So it's very, very difficult. And that can happen to anybody. I think for me, the what's important is that we, do what we can. Do we do the best that we can, not only to protect ourselves, but to protect others around us. And so there are people that get very upset and say, we're taking away your freedoms when we ask people to wear a mask in public, and when we make it a requirement, and we find people, or when we close a business. But the fact of the matter is, it's absolutely no different than than asking people to wear a seatbelt, or telling people to stop at a stop sign, or telling people that they can't text and drive at the same time. I mean, these are things that we do that are basic for our own health and safety, and we enforce them. And the reason why we enforced it was because our hospital administrators came to us and said, "Look, our hospitals are getting inundated. We have to get to a point where we can manage this. And if we don't take, prophylactic measures quickly, and if they don't get the viral level down in this community, we're not going to be able to sustain this level of census for an indefinite period of time."
Yeah, I would say, do you feel like at what point do you re-shut down the city? Is that even on your radar because it's so economically devastating, or what are the options?
Yeah, of course it's on our radar. It can never not be on our radar. I mean, I think it's a tool that we have. It's a tool of last resort. It's not something that we want to, if we didn't think it was a big deal, or if we were, people oftentimes make this a false choice. It's not just a choice about saving lives versus not saving lives. If the issue were about saving lives and saving lives alone, we would have shut down the city a long time ago. It would not have been a difficult decision. The problem is that you got human devastation on both sides, right? You have human devastation in the sense that if you don't shut down the city, it's possible that more people will die. And then you have human devastation on the other side. If you do shut down the city, hundreds of thousands of people are going to be without work. And there isn't that federal safety net. And we don't know what consequences to human suffering are going to be for people not being able, to work, not being able to provide for their families. I mean, are we going to have social unrest? Are we going to have civil unrest, or people who can't eat? How long can governments feed people and provide the safety net before the fabric of society starts to sort of fall apart? So, I oftentimes hear the question asked as if it's, shut it down and save lives, or don't shut it down and don't save lives. And it's not that simple, unfortunately.
Yeah, correct. I think that's a very important point you brought up. And I think when people watch the news, they hear about deaths from the virus, the hospitals being overcrowded. All of that is true. What you don't hear a lot about is the fact that during a shutdown, there's almost as much, if not more, damage done to people, just like you said, people who are jobless, homeless, financially devastated. So that's a good point.
And by the way, think about the healthcare system itself, right? Just because you're taking away one thing, or you're reducing one thing, if people can't, if they can't go out and they can't provide for themselves, they may have a host of other issues that are medical in nature that could also contribute to the hospital system continuing to get overwhelmed, that are not COVID related. So we often think of medical issues as only COVID issues versus not COVID issues.
Yeah, correct. I mean, just being here at a hospital myself, another problem with COVID that's not really focused on is the hospital gets full of COVID, and then, like you said, non-COVID problems aren't able to be handled. So hopefully, as COVID numbers go down, people that have heart disease, cancer, tumors, those people can hopefully get the care that they're currently not getting because the hospitals are full. What do you think made Miami such an epicenter for this second wave? I mean, obviously, a lot of places are being hit, California, Texas, Florida, but Miami in particular just was at the very top. What factors do you think made Miami the world epicenter for this?
I think our density is probably one of the main ones. I mean, we were on the call yesterday with Dr. Burke from the White House Coronavirus Task Force, and the only city that's like us that has had somewhat of a plateau at a very high level after implementing significant remediation measures is Houston, and it has a similar density. So I think density is a major component of it. Just the fact that people are close to each other, and they're touching the same things or in the same spaces, even if they are wearing masks. So that's why we are enforcing the mask rules so vigorously.
And how hard is that to enforce, the mask rule? I know that that's so controversial when it really shouldn't be controversial, but how difficult has that been to enforce?
It hasn't been that difficult to enforce it. The one thing that we do have is an exception for exercise. And so that, is an exception that, a lot of people can avail themselves of. I think the bigger issue is, there's a thought out there that it's not constitutional, or that it's a violation of people's civil liberties. And I was having a discussion with someone who was telling me that, and I read to them our order, right? And what it's based on. It's based on the state constitution. It's based on state statute. It's based on the governor's invocation of an emergency declaration, our charter, our state or our city ordinances, and our declaration of an emergency. So it's based on 6 sets of laws that allow for us to do that. And the fact of the matter is, wearing a face mask, as uncomfortable and as unpleasant as it may be for some, is something that's going to be hopefully temporary. It's not something that's going to be. It's not like wearing a seatbelt that you have to wear every single time you get in the car. Also, you hear that annoying noise, ding, 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 until you put it on. Right. So, I mean, that's just, it's just something that we have to do. It's, and for the time being.
Yeah. I mean, I think your leadership in that role has been tremendous. This is obviously a big topic. I guess you'll have to summarize, but what are your thoughts on the schools reopening in just a couple of weeks? And do you think that's going to lead to another potentially third wave or a longer second wave with the schools reopening in a couple of weeks?
Well, I think I agree with the superintendent in pushing back the start date and also beginning virtually for at least a month. I think had he not done that, we're talking about 400,000 people being integrated into the system. And I think that would have been, it would have been impossible for me to imagine the amount of people that's a city. And let's put aside the risk to children, because there are 2 sides to that debate. Some people think that they're high risk. Some people think that they're not. I was with the Surgeon General of the United States 2 weeks ago, and he said that a study came out that if you're 10 years or older, you have the same ability to transmit the virus, the same viral load as an adult. So, he did not think that a child 10 or over would be any safer as a transmitter or as a receiver of the virus than an adult. And that's the U.S. Surgeon General who was telling us that. So, I cannot imagine a scenario in which you put 400,000, which is almost the size of the city of Miami, into a system, and our cases don't continue to go up, and they're already at a level that's unsustainable.
Yeah, I totally agree. In terms of long-term plan, because obviously COVID is not going anywhere anytime soon. This is not going to stop at the end of the summer. There's probably going to be multiple cycles.
Sure.
What type of long-term planning is Miami doing for 6 months from now, 1 year from now? Hopefully not longer than that, but long-term plans to deal with COVID.
Yeah, I think one of the big issues is there has been a lack of long-term planning. And I don't know if it's because people got caught so flat-footed by this, and particularly by the second wave, which I think not a lot of people expected, and certainly not at this ascension level. And I think, I'm going to be honest with you, brutally honest. I don't think that there is good long-term planning right now. I think people are looking at this as this is the emergency that's right in front of us, right? How how is our hospital system doing? We look at these statistics every single day, right? So I think that there's been, and I understand it, right? Because this is a crisis that's right in front of you, and it's a crisis that you need to deal with on a day-to-day basis. But I do think there needs to be leadership. I personally believe it should come from the federal and state government, right? That's what I believe. But in the absence of that, we're going to have to step up and come up with some long-term strategies. I think part of the long-term strategy is we do know that hospitals, doctors such as yourself, and hospitals and therapeutics are getting better and better every day. At treating COVID, the outcomes are better, that we've seen over time. So part of it is trying to sort of postpone and push back people from getting sick so that we can have better therapeutics and potentially a vaccine, et cetera. I think that's part of it. What we don't want to be doing, what we would prefer not to be doing, is closing and opening and closing and opening and closing and opening, because I think that creates a bunch of problems. I mean, I think the first problem is, what's the purpose of closing if you're going to open and we're going to be back to the same situation in a month or less? I think people will get frustrated over time, and they'll be less compliant as well. And I think it's also difficult for businesses. It's difficult for a restaurant, for example, has to buy a ton of merchandise, a ton of product, and then be closed a month later, have to hire employees and then be closed a month later. So, psychologically, it's very difficult to be opening and closing. So we're hoping that the mitigation factors we put in, the curfew, the mask in public, the restaurant rules, all those things continue to drop the level. We have seen progress from about a 21% positivity rate to now we're at about 18%. I think yesterday we're at 16.5. So that was a good day. and our level of virus went from a high point of about 125 new cases a day growth rate to a growth rate at a low point of 8 new cases per day over the last few weeks. So that's been positive. So there has been some positive movement. It's just never fast enough for us. You know what I mean? We want to see it happen faster so that we stop seeing so many deaths in our community, and our hospital system gets healthier faster.
Well, listen, Mayor, thank you so much for your time. That definitely sounds much more encouraging based off what you said. Hopefully we can control this. We don't have to keep shutting down, opening up, shutting down. And hopefully eventually there's a long-term plan for this, vaccine. But just again, thank you for all your leadership. Obviously, it's an incredibly difficult time. And I know that I speak for everyone when I say thank you for everything you do. Obviously, it's a very busy and stressful time.
Thank you, Doc. And I just want to say one last thing before I hang up, because I see some of the comments. And I just want everyone to know, this is a little bit off topic, but we're not cutting our resiliency office. I know that's been one of the main topics. We had a grant funded position for a chief resiliency officer that expired. And we have named a new chief resiliency officer, and we folded that department into our resiliency and public works department. It's larger than it's ever been. And we have a $200 million resiliency program, which is the largest resiliency program probably in the United States, and maybe one of the largest ones in the world. So it's something I'm very proud of. But I saw, it's okay. It's been something that's been catching a little bit of fire online. And I just wanted to address that issue.
Well, wonderful. Thank you so much, Mayor Suarez. Okay.
Thanks, Doc. You got it.
Take care. Be well.
Thanks. Bye.